Pectus program here at Texas Children's is a full comprehensive clinic that starts from the beginning of diagnosis all the way through treatment. Additionally, there's multiple other services that are involved with the care for our Pectus patients. This includes anesthesiology, both for the intraoperative care but also for the pain management after surgery. Pectus excavatum is a chest wall abnormality where kids have a sunken chest. It can be centralized right over the sternum, or it can be off to one side where it involves the rib and the costal cartilages.
When we see patients around the time of puberty, we find that a lot of them will be complaining of symptoms of chest pain or shortness of breath, particularly when they exercise. When we decide that someone is having symptoms, they are worsening, it's usually something that we'll progress to testing for. And the two tests that we typically do are a chest CAT scan and pulmonary function tests. And those give us pretty much all the data we use if we need to establish a surgical plan.
The treatment for Pectus excavatum has evolved a lot over the years. It used to involve a very large invasive surgery, but we moved completely away from that to a minimally invasive repair of Pectus excavatum. And what that has evolved to is 2 small incisions, maybe about 2 to 3 centimeters on each side of the chest. And we use another about half a centimeter incision on the right side of the chest where we actually place a camera into the chest so we can minimize the risk and watch everything that we're doing firsthand on a monitor. We then insert a bar from one side of that incision to the other side, and it goes directly behind the sternum. And as we rotate that bar over, that's what allows the sternum to pop out and now become instantaneously from a sunken chest to a flat chest. These bars that we put in last about 3 years is what we typically keep them in for. That allows the chest to remold itself. And once it remolds itself, about 3 years later, we can do an outpatient procedure to remove that bar. The Pectus excavatum surgery where the bar is being introduced typically takes about 1 hour to do, and usually the hospital stay afterwards is in the order of about 3 to 5 days. The outpatient surgery for bar removal, which happens about 3 years after the bar has been placed, is about a 45-minute procedure, and the kids get to go home the same day.
Pectus carinatum is basically the inverse of an excavatum. So the chest is protruding. Again, it happens around the time of puberty is the most common time. So you'll see patients who will swear that everything was fine a couple months ago, now their chest is protruding significantly.
The treatment for Pectus carinatum has evolved immensely over the last few decades. It used to always involve a large surgery with an extended hospital stay, but we've completely gone away from surgical treatment for Pectus carinatum. Now the first line of treatment is bracing, and it's very similar to braces for your teeth. Basically, you place a brace over your chest, you wear it for an extended period of time, which can be in the order of a few months or up to a year. Bracing is very individualized from patient to patient, and it depends on what their defect looks like to what their treatment plan is going to be. On average, the total bracing time is about 8 months for Pectus carinatums, but we have kids that come back in 1 to 2 months that see a significant change and are very happy with it, which increases their compliance with the bracing and so forth. We're looking for kids that are in their kind of young adolescence to older teenage years. What we're looking for on an individualized basis is that they don't have an immense growth spurt ahead of them. As they have a big growth spurt coming up in front of them, then oftentimes there's a higher chance of recurrence. So most of the Pectus excavatums we're treating in around the 14-year age group and older. And for the Pectus carinatums, we're starting to introduce bracing around 12 years of age or older. For me, the best part about taking care of patients with Pectus defects is that we're immediately helping them with their self-image and their the psychosocial concerns that they have associated with self-image. What they feel is, I don't want to participate in gym class, I don't want to take my shirt off to go to the swim, and immediately after the surgery is done, they have a flat chest and no longer have to worry. Telemedicine is a great opportunity for us to continue to expand the treatment we offer to kids in our region, but also to areas, to kids throughout the state and maybe throughout the U.S. There are not a lot of specialists that take care of Pectus defects around the country, specifically in the pediatric population. And what telemedicine offers us is the ability to increase our outreach and reach a higher number of patients throughout the region. We're currently using telemedicine for initial consultations for certain Pectus defects, but we're also using it a great deal for the post-operative follow-up for patients that live quite a distance from us. One of the things we're doing at Texas Children's with our Pectus program is we're constantly collecting data and doing research studies to improve the care we offer patients. And sometimes there are minor tweaks, like what is the best pain management after the Pectus surgery that we offer you? What is the best use of x-rays before and after surgery? How can we minimize the cost to the health system before and after Pectus surgery? What is the best way to treat a carinatum? And what kind of pressures should we use with our dynamic compression bracing? These are all questions that we're asking constantly. We're a great institution that continues to grow, and the care we provide is extremely comprehensive from beginning to end. The hospital itself is fantastic. As you take a look around, you see what great facilities we have and what great staff we have throughout.